So this is a funky immobilizer. It says inside this funky immobilizer made of art board and art tape, packaging tape, applied noon 3/4/17, and it explains after an incident with a man who didn't have his dogs under control here in Hahamungna, where I was standing on the bridge praying, and so my sudden movement grasping my own dog's collar with this hand, which is instinctive because I'm right-handed, made it very clear that if I do that, I mean, with that was it's hard to be clear on the documentation, but I mean, because I'm pretty upset. I'm not in pain. The tramadol is working, thank God. The tramadol is working. It has some side effects, but it has relieved the pain. But I was, yeah, actually pain is, yeah, you know, I'm aware of some pain, but I have the sharp pain. The reason, oh, this is Hahamungna, beautiful place. This is where I come to do my art, do my prayers. This was a Tongva village. I feel very good here. The very old oaks, wonderful place. And being Native American, my health, spirituality is a part of my health. So, you know, I mean, this is as important as meds to me. So anyways, so I came, and I have come every day since the injury to pray, or since I knew that it was serious. And so this man had his 3 dogs running loose, and I had to reach. He wouldn't control them, and I reached my dog's collar, who was under control, but, you know, I mean, anyways. And in that action, sharp pain with the movement of the cactus needle in my knuckle. And so I just decided I better immobilize it. I've been concerned all along that it is moving in and of itself, and it is sharp. It can do tissue damage. It could conceivably get inside a vessel, or the tip of it could, you know, I mean, there's all kinds of things that can happen with an 1/8 of an inch plus sharp cactus needle sitting inside the tendon sheath of your right hand, index finger. So from past, well, anyways, I just was concerned. They're leaving me in pain, and they're, other than a friend helping me figure out what to ask for and how to ask for to get pain relief. And they didn't immobilize. And they know exactly what it is, and they know that it is sharp, and that it is moving, that it is causing pain, that it is causing infection, and that it is potentially causing damage. So, you know, I mean, I'm having to do better care based on having been through this 30 years ago. The first thing they did in county ZR, first thing they did, they wouldn't even give me pain med. First thing they did, and it was a painful experience because they straightened my finger to do it. Yeah, I remember. I had a 1-inch piece of wood in there, and they straightened my finger to immobilize. That was the orthodox first order. They couldn't give me antibiotics. They couldn't give me pain med. That's procedural until I was seen. And labs were drawn and all of that good stuff. So the first thing they did, knowing I had a foreign body in this very index finger, it was not a sharp needle, but just but a sharp splinter, 1 inch long, they immobilized. So after, I've been worried about it. I've been concerned that what's happening with this, and you know, I don't use my finger. I have held my finger up. I've limited my use of the hand prudently, but this incident just proved to me that, you know, I mean, I am moving it more than I probably should on a regular basis, and because the sudden movement made me realize that it's gonna jab into tissue if I bend. So so that's why I immobilized, and I'm documenting. I've got pictures and everything because as I conveyed to the doctor who helped me negotiate pain med, which they weren't addressing pain or willing to offer what I needed, I had to ask her to help me decide what that would be. Call from the ER to a pain doc for Kaiser, who gives good care, to coach the ER doc of this hospital, the treating hospital, who was more interested in talking to my doctor about what he prescribed, which they didn't follow up on. It wasn't prescribed for this. It is not a drug I could use, and if I had had it on hand to use in as much pain as I'm in, I guarantee you I would have been taking it. So, you know, the ER doc was more interested in what my primary care physician wanted to have happen to me, which was inadequate pain remedy. So I got my friend's professional input as a Kaiser pain doc, and negotiated getting something that did prove to be effective, not without side effect, but pain relief. And the pain was increasing by the hour. And absolutely every single healthcare professional I talked to, clerical person, clinic person, absolutely everybody knew what had happened, understood how painful that is. Nobody did anything about it. Absolutely every single person knew. I was holding my hand over my head, telling them what happened, telling absolutely everybody I dealt with that I'm in pain, and they did nothing. So, so again, I decided to immobilize this because I'm trying to protect my hand. I'd rather not lose the use of it, as I did with the malpracticing Dr. Shin, an orthopedic workman's comp doc, who, when, because of UPS negligence, putting soap in the water of the vehicles that I was washing, I slipped, I fell, I broke my wrist, and was treated by Dr. Shin as a workman's comp case, who discharged me knowing I was in pain, had pain in my hand, and that it did not have full function. He wrote on the notes, it is documented, that he explained to me that that's a pre-existing condition of Kenbox, which I had never had any problem with before. It took me a year to get through all the bureaucratic tape to get to the state doc, who said, I don't see that as a problem. Kenbox doesn't bother a whole lot of people. They don't even know they have it. And from what he was seeing, right off the bat, he said, he prescribed physical therapy. I got the use of my hand back. I had gone without the use of my hand for a year for no reason. It was simply a matter of inadequate physical therapy. And so the state doc, that's all documented. So that's why I'm being very protective, already seeing the inappropriate attention to my care for the use of my hand, which is vital. I'm right-handed, more vital than the last one. I lost the use of the left one for a year for a workers' comp orthopedic doc. In other words, I don't want a doc who's more invested in making money for somebody than he is in protecting my hand and making sure I have full use of it. So I'm documenting everything, because if I walk out of this with having lost anything, I want it on record. I want it fully documented.